afternoon, everyone. It is 2:30. Welcome to Cook County Health Department Schools and COVID-19 Weekly Update. My name is Kelly Jones. I am a senior health educator with Cook County Health Department in the Community Engagement and Health Education Unit. I will be your host and your moderator for our weekly webinars. Thank you all for taking the time out of your busy schedules. I know a lot of people started school this week, and it is very hectic, including my high schooler. So it's been a rough week. So pat yourselves on the back for making it through this week. Nice to see all of your lovely faces. Carmen, you look beautiful. I'm looking at your picture. Welcome. So let's get started. Our objectives are, as usual, to provide updates and support to schools while navigating COVID-19, answer any frequently asked questions, and provide the latest and greatest contact information and resources as they become available. Couple announcements, and then I will toss it over to our presenter, Lexis, out today. So the lovely Michelle will take over. All the webinars are recorded and they're being uploaded onto our website. You can search our website. I will pass out the web information later on in the links, and our webinars are being recorded and they're being uploaded to YouTube and to our website. So you can use those at your leisure if you want to use some engagement with your staff or your admin. And also the slides are passed out at the end of our webinar. Email them to all our registered participants. So here's our contact information. If you have any questions or concerns, you can email them at our COVID email address. It's ccdph.covid19@cookcountyhh.org. If you have any questions that weren't answered or you think of prior to the webinar and you'd like them to be answered ahead of time, email that email address by Thursday, close of business, and we'll make sure we get that question answered in the webinar. If you have any communicable diseases to report, not just COVID, any communicable diseases, you can report them to ccdph_schools@cookcountyhhs.org. Our general Cook County Public Health website is below. Our school-specific website is below that. All of these links will link from our general website, but it's just easier if you have the direct links. If you have any questions about the vaccine, you can get that information on our cookcountyil.gov website. And if you have need for toolkit information, flyers, or downloadable information regarding COVID-19 and the vaccine, you can find that at the website below. I've had some people reach out. They wanted to know where they can find some information that they could print off and put around their school. So there's some printable information on that website you can find. Because of low vaccine uptake in the following areas that are listed, we are prioritizing them. We are trying to make extra inroads in these areas to try to promote the vaccine, provide health education, host events. So if you're interested in working with Cook County Health Department to get the word out in Burnham, Calumet City, Dixmoor, Dalton, Fort Heights, Harvey, Markham, Phoenix, Riverdale, Robbins, and Sauk Village, please feel free to reach out to us if you know of any community partners in that area who could help us, or if you have any great ideas about how to reach this area for vaccine uptake, please let us know, because we're trying to reach out to these communities and increase their vaccine uptake. For those who participate in the EpiPen request program, Keith Wynn is no longer coordinating the EpiPen requests, and you can send those requests to me, Kelly Jones, at kjones1@cookcountyhhs.org. I added a caveat because we had a little confusion earlier this week. So the Illinois state law says that anybody who requests EpiPens must be a medical professional or have been trained in the administration of medication. And a secretary or admin or someone who is not a health professional or have been trained cannot send in an EpiPen request and get that prescription. So I just wanted to make that distinction so we don't have any more confusion. But feel free to reach out to me if you have any more questions about that. If your school has an existing COVID-19 testing program, we'd love to hear about it. That's how we find out more about what's going on in our community. There's going to be a link at this slide, and also I'll drop it in the chat. Feel free to fill out the survey and let us know. If you or your organization would like to participate in the Rapid Antigen by Next test program, you can request it, fill out the waiver form, and get approved. and get those test kits sent to you for use. Additionally, based on the webinar that we had 2 weeks ago where Shield and IDPH presented, you can request those Binax tests through us, Cook County Health Department, or you can request them through IDPH. It doesn't matter how you request it, it's just up to you. So if you're interested in requesting them through IDPH, the dph.antigen testing at Illinois website, website and email address is where you can go to do that request. If you are interested in having a health professional speak to your event about COVID-related subjects, and it doesn't have to be schools, it can be any event, you can submit a speaker request using the Google Doc form below, and that link will also be sent to you. If you cannot leave the house to get your COVID vaccine, or you need a ride to get your COVID vaccine, and you fall under the categories of 65 and older, have a disability, or use adaptive equipment, you can call the 833-308-1988 number and have someone either come to your home to give you your COVID vaccine or arrange for a ride to go to a facility to get your vaccine. And this is information on on-site clinic vaccinations if you'd like to request that for your school or mobile days or any other resource event. Thank you for your time, and I will have Michelle, I will stop sharing and let Michelle get going. She can start sharing. The chat is disabled for the duration of the presentation so that everyone could pay attention to what Michelle has to tell us. Towards the end, I will open it back up for questions and answers. Thanks, Michelle. Take your time getting yourself started.
So my name is Michelle. I am one of the epidemiologists at the Cook County School team. A lot of you might know me already. For those who don't, it's nice to meet you guys. Before we get started, I would like to thank all the schools for working with us for the past year. You guys are absolutely amazing. We last year, we pretty much had you guys put in protocols to try to keep COVID out of the school completely. And for the most part, you guys succeed at this impossible mission. So, unfortunately, we will have to ask you guys to do this again this year. We're going to try our best. This is our agenda. I'm going to go through some of the new guidances. I'm going to go through the metric. We're at high transmission currently. We're going to talk about those travels guidance that we always have question on, and we're going to talk about some of the new IDPH stuff came out with because we do have some new outbreak definition. We do have some quarantine alternative, and the test Tuesday is always on our question box, so we'll definitely put it on here. The reason why I want to start with this slide is because you know what? Sometimes we work so hard to go through all the little things and we forgot why we're doing it. And I really feel like this slide really summarized what we're trying to achieve for this year. This is something for the American Academy of Pediatrics. So, it's not from the CDC, it's not government, but it really aligns with our goals. Oops, pushed it too fast. Our goal this year is to have policy that would keep the kids safe and keep the kids in school, in class. Our second goal is to try to get as many people vaccinated as we can. Our vaccine is great, it works, it's safe. And our third goal is to, try to get everybody masked in school. Mask works. We've seen it work, and we really feel like having those masks in school will make our lives so much easier in preventing COVID. And I also want to share this quote that I actually took straight from IDPH. And it really kind of resonates with me that the AAP advocates for all children, not just your kid, the wealthy ones, the poor ones, the sick ones, the healthy ones, the physically and mentally challenged, the kid who is being raised by his elderly grandmother and doesn't have means of transportation to get the vaccine yet, the kid who doesn't have enough food but gets 2 good meals at school, the child that doesn't have access to the fancy laptop or functioning internet. The AAP give us advice based on what will help our community and better support and protect our kids. And like I said, it really resonates with me. I'm someone that truly believes in public health, and I really believe what we're doing benefits the whole community. Okay, so I'm going to start with some housekeeping things. We do have a new email that goes to our school team that the school can use to communicate any reporting, any questions. It really streamlines our work. It's great. We would prefer to have, case report maybe just once a day because we are dealing with a few hundred schools in Cook County. So we're trying our best to keep our mailbox, clean. We put all our reporting document and instruction on our school website. This is the school website, and I am trying our best to throw all the documents the school might need on there. But as you guys know, with everything changing constantly, it is it is a chore to keep that up. Um, and this is just a reminder to report confirmed and probable cases. Um, One of the things I do have to remind the school, reporting is not an option. Reporting is a state law. And for confirmed and probable cases, we're looking for anybody with a positive diagnostic test. So it's really just any COVID test that's not an antibody test. And we're looking for anybody who's a close contact and has symptoms. One of the things to keep in mind, if they're in the process of getting tested, let us know. Because even if you have a close contact with symptom, if they come back with a negative test, they'll no longer could be a probable case. So, we kind of like a little bit of a heads up if we could end up, quarantining some people and maybe having to release them later. And this is also a reminder that the infectious period of a close contact begins 2 calendar days before the onset of symptom for the symptomatic person. Or if they don't have symptom, it would be 2 days before they took the test. And I really want to show the schools this graph to know that why we're doing that. This is the infectious rate of someone with COVID. And as you could see, it is the day before and the day after the onset of symptom is when someone is most infectious. So I know some schools might question why, we would want to go back to calendar days. And keep in mind, it's not 48 hours. It is 2 calendar days because when we were doing 48 hours in the very beginning, it was really hard for us to count back the exact hours. So IDPH actually changed the wording to allow us to use 2 calendar days. Report all close contacts to us. And these are some of the newer definitions for close contact, so I just want to go over it real quick. Anybody who's within 6 feet of an infected person for a cumulative of 15 minutes over a 24-hour period. So, for example, if I talk to a person 5 minutes in the morning, 5 minutes at lunch, 5 minutes before I leave, that would be a cumulative of 15 minutes over 24 hours. But if I talk to them, say, 10 minutes yesterday, 10 minutes today, that would not be a cumulative of 15 minutes over 24 hours. For student in classroom setting, and this is only in classroom setting only, we only need to look at close contact that's within 3 feet if both the case and the contact are fully masked and, correct and fully masked. This is a question that's been coming up. Even if someone's fully vaccinated and even if someone is close, had a positive test within the last 90 days, report those to us anyways. They would not need to quarantine. I do want to clarify. However, once in a while, we do have a fully vaccinated person and we do have someone who had COVID within the last 90 days that became infected. And we don't want to get that case and wonder, how did this happen? Where did this case came from? And this is another thing that's new. Generally, someone who was exposed to a outdoor case that's only outdoors, we would not consider them a close contact. Now, if you guys have noticed the kids are sneezing at each other outside, when they were infected, by all means, report it to us because droplet is a huge outdoor transmission. It could still transmit outside, I should say. And if it's obvious, there's some kind of fluid exchanging happening. But for most normal activities, we would not consider outdoor contact a close contact. This is a little bit new as well. Last year, we were providing the return days. This year, we have all these options for returning. You guys have the test to stay, the 7 day, the 10 days, the 14 days. We're just not sure we're able to give you guys 4 or 5 different return days, which is why um, we are asking the school to put on the return day when they submit the list to us. If something looks really off, someone will email you back, be like, hey, what's going on? But for the most part, we will go with the date the school put down. We also have the testing program survey link if you guys could fill that out for us if you're doing a testing program. Metrics. We always put our metrics up every time, and currently we are at high community transmission rate. We have broke the 100 case per 100,000 per week, which is why we're there. So just a quick reminder, this is the reason why we are asking symptomatic student that needs to return to school to get a lab-based PCR test, because those tests are a lot more accurate and they're a lot more appropriate to use when the community transmission is high. If we do go back to low chance community transmission, we will be allowing for the test that's a little bit less accurate, including the antigen test. But currently, we are recommending a lab-based PCR test. Travels guidance. This is something we have questions on all day, every day, all the time. Partly is because there are always changes to the travels guidance. With the Cook County Health Department, we we follow the travels guidance as far as map for Chicago. So we're asking anybody that traveled to one of the orange states to file quarantine rules. And these are updated on our website as well as the Chicago website, I believe once a week. If someone is vaccinated, they do not need to quarantine. There is a recommendation for testing and monitoring for symptoms. We will not keep someone from going back to school if they don't test. However, if they're symptomatic, they obviously need to test. And as far as the quarantine, now with the Chicago guidance, people are able to test out of quarantine if they test before travel. Currently, we are recommending to follow the CDC quarantine guidance. And this is a little bit different than what we've been doing before. We actually had some meeting, we talked about it with the transmission rate, the way they are. And even before, when we were using the Chicago, some of the school already told us, you know what, this is a little bit too lenient. We're letting cases in school. So currently, this is our recommendation, is for people that are unvaccinated. If they travel to an orange state, they need to quarantine for 7 days after they travel and get a test 3 to 5 days after they came back. And if they do not test, we are expecting them to quarantine for 10 days. And this is being updated on our website. I'm trying to get our website to be really clear on what we're going for. I know a lot of the things are missing in the travel's guidance because we get questioned about, what if they only been there for half a day, what if they only, they're there because of a custody issue. Keep in mind, the Cook County Travel's Guidance is a recommendation. The school have to write to kind of tweak it a little bit to make it work for them. But we're only providing a very general travel's guidance. Update for school outbreak definition. Last year, we were doing 5 connected cases in a school to be considered outbreak. This year, we're going back to 2. The reason why we IDPH switched to 5 last year is because we weren't able to keep up with the amount of outbreaks if we were doing 2 cases. But IDPH decided that, you know what, we should be able to go back to do the 2 cases that's more aligned with the CDC definition for outbreak, which is where this is coming from. What we're looking for in an outbreak is we're looking for 2 cases that's connected by a school and hopefully only the school. So for example, if I have 2 students and their siblings, and they both became positive, we would not consider that an outbreak because they're connected by their household. Or even if I have, 2 children, they had a play day outside of school and they're in the same class and they were both positive, they would not be considered an outbreak. But say if I have a teacher and a student that I'm pretty sure that they were not meeting outside of school and the only time they were together is in the classroom, we would probably consider that an outbreak. A lot of time we kind of wait and see if there's any more cases as well, because sometimes it's really hard to tell if both of them had cases connected outside the classroom or if they're really connected by the classroom. So we are a little bit more careful when we declare an outbreak. Quarantine alternatives. Good news this year, the school has a lot of options for quarantine. As always, we do recommend the gold standard of 14 days of quarantine because that is the safest. However, if the school is able to meet the criteria for the other quarantines, the school is allowed to use the quarantine for their staff and students because last year we weren't allowing the 7-day quarantine for the students. For the 10-day quarantine, when the student returns to school, we do want to make sure the student is able to social distance and mask while they're in the classroom at least 3 to 6 feet. They do not need to test. They do need to be symptom free for 10 days. So for example, if they develop symptom like, 6 or 7 days in, they would need to test right away, or if they even develop symptom after they return to school. We do have, I think we had maybe like 1 or 2 cases last year where we did the 10-day quarantine and someone developed symptom on like the 11 or 12 days. We end up having to take them out of school again because they're technically still in their 14-day period. With the 7 calendar day, it kind of have the same caveat. When they return to school, they need to be able to social distance and they need to be able to mask the whole time. The other caveat with the 7-day quarantine is they need to get tested after the 5th day, so which mean is on the 6th day, and they could return on the 8th day. And this is counting the day of exposure as day 0. So I do want the school to keep that in mind. I actually had a bunch of questions about that recently, and I really think after the summer vacation, we kind of start questioning ourselves, be like, how do we do this again? So that happens. Other option, which is our newest option, we haven't really done this too much yet. So while we could answer, the school questions the best we could based on our guideline, we don't have a lot of experiment with it yet. So with this option, it's only for people that are enrolled in one of the testing programs. The close contact would be tested on day 1, 3, 5, and 7. They could use the PCR test or they could use the shield test. Ideally, we would have to have a test within the last 7 days because they've been screening every week at school. And if the school do choose to choose the test to stay, do let us know. One of the caveat with the exposure is for the test to stay, the student have to be either the student have to have correct and constant mask use. So the exposure has to happen when both person are completely masked. To us, it means it's really mostly for school exposures. And maybe some sports team, because we're not sure we're gonna trust, the mom that come in and said, oh yeah, we completely masked our kid at this birthday party or something, in that degree, or, we were completely masked in a play day. So I'm not sure if we would trust that. But maybe like an outside sports team, the coach be like, yeah, they were completely masked. We'd be okay with that. And let's put together some scenario for us, just in case the school have any questions. Like I said, we do want the student to be in our screening program. Ideally, we should have a baseline test before the test to stay. It gets really tricky because with the PCR test, we're picking up positive result from someone that might be already infected, or they might be asymptomatic. So if we have somebody who is not already in the program, we might be picking up not someone that was exposed, but someone that exposed our case. So which is why we really want that person to already have like a baseline test result. Someone is exposed outside the school environment. Okay. This is the same thing I talked about earlier. If they have a part-time job, if they were in a sports team where we're pretty sure, the mask was implemented, they would be able to use the test to stay. But otherwise, it would be hard for us to really say that the mask was correctly worn. Ideally, we would not want the people in the test to stay to be riding the school bus or eating in the lunchroom where they cannot be 6 feet apart until the quarantine period over. However, remember, our goal is to keep the kids in school. If those are the only barriers, we are going to allow for the test to stay as long as they're asymptomatic. We would prefer for the school to try to space them out, put them in a different room, keep them 6 feet away. But we know now that, with all the kids being back to school, that might not always be possible. With the test to stay and musical instrument, we always know that the musical instrument have a higher rate of transmission, and we would prefer for them to play outside. We are expecting some extra music guidance coming up, so hopefully, we'll get some more information on that. And this has to do with testing invalid, a second test. Pretty much, the school will need to try to perform the test as quick as possible, following the 1357 guideline, even in the weekends. And this is just to clarify, someone in the test to stay, not only can they go to class, they can only participate in sports or other extracurricular activities. We do want to try to keep them masked and try to keep them distance or have them play outside. These are some upcoming things from IDPH that we got from a meeting, but because we don't have it in writing yet, I don't want to, get myself in trouble for saying something that IDPH might change in a little bit. Some of the things that we saw so far is last year did not, allow to the kids to be masked with the gaiters, and this year CDC actually put it on their mask guidance that if there are at least 2 layers, they could use it. The daily screening for fever, so that's the door check for temperatures and fever, is no longer recommended. I don't think that's new, but IDPH had it as a new thing. Home testing is not recommended for return to school or proof of negative result. So just so you know, if home testing are getting really popular right now, in fact, I actually order a box just to see what they're like. With these home testing, we cannot use the negative result to return a kid to school. However, if someone do test positive and return it and report it to the school, do let us know because we do have to treat it as if it's a positive case and do the contact tracing. And I know I've been getting a lot of questions about this on household member when a sibling is sent home. IDPH did set to us that they have a guidance coming that will allow a sibling to stay in school if a household member is sick and is being sent home to be tested. And I believe what IDPH said is they could stay for 24 hours until the test is completed. But until we have the wording out, and I believe it is coming out with the new FAQ, we really don't want to start spreading too much rumors, until we know for sure what's the caveat behind it, if there's anything. IDPH also stated there will be some cleaning guidance. Well, I went over the new outbreak definition. I don't think there's anything new to it. We are expecting a new music guidance and we are expecting some new testing guidances from IDPH. So, as we know, things are always changing. So these are some of the submitted questions that we got yesterday, and I did my best to answer them. But like I said, with things keep changing, I hope I'm doing my best. If someone has prolonged exposure to a case in a bouncy castle, are they considered close contact? And there was a lot of questions about this bouncy castle. I'm not sure what's going on, but yes, we are going to count the bouncy castle as close as indoor contact. Second question. They just received the Binance supply from Oak Forest. They expire in 4/2021. Are these still good? Binance has a memo out not too long ago that kind of extended the expiration date. So there is an online memo that has like all the lock numbers and when they should be expired. If you can't find it, just shoot me an email, but usually I just look that up and it pops right up at me. Could we use Binax now to test vaccinated close contact at 3 to 5 days? Yes, you could use it. Keep in mind that testing for a vaccinated person for close contact is a recommendation. We're not going to kick someone out of school because they would not test. We would prefer a lab-based test because they have been exposed to COVID or someone that's infected. However, like I said, we would not kick somebody out even if they do not test at all. To help clarify, the reduced quarantine option 10-day, 7-day test to stay if students have lunch or snack in the classroom at less than 6 feet are not eligible. Which, you know what, I think I covered this a little bit earlier. We would definitely prefer to be able to keep these kids apart and 6 feet. Again, we're trying to keep the kids in school. So keep the kids, as far as you can. Remember, we also have layer mitigation at the school. We're doing testing, we're doing masking, we're spacing them out, we're, getting ventilation, we're getting hand washing and cleaning and disinfecting. So hopefully, that would not cause a huge outbreak for us. Now, if the school is uncomfortable because they feel like, you know what, we have the medication, but, we were seeing some spread and we're really not comfortable with offering our student while they're short in quarantine, just let us know. We will support you guys. You guys are the ones at the school and you guys know what's going on in your buildings. So, which is why, it's one of the reasons why we're not putting down the return days because we really don't have the whole picture when we're not at the school. Can the student take mass break inside the room as long as well ventilated with outside air or air purifier? So I actually look into this a little bit, and with the governor's order, masking is required indoors at all time except I think when they're eating or drinking. So I did grab this picture from one of our directors. And this is just to show you guys why, masking is very important. Because just looking at this picture, I just want to put a mask on this person right away. The mask really is to contain, any droplet. And I know, there's a lot of talks outside, really doesn't, it protects everybody. There is some protection from getting the droplet on the face, and there definitely is a lot of protection from keeping droplet from spraying. Confirming that students need to be participating in the weekly shield honor to the test Tuesday. Yep, that is correct. They need to, actually, I take it back. They need to either do the shield or Binax or some other kind of testing program that the school offer, but it will have to be a school-based testing program. The travel guidance has changed. Is there any guidance that would be offered to the school that would make this more manageable? Can there be a test to stay option for travel's quarantine? What about students who have custodian arrangement with parents on the other stay? What about students who are only going to private residence? Like I said, we are only offering a very general travel's guidance. And if the school want to tweak it in one way or the other, it is up to the schools. Any specific guidance for gym, or should they follow the guideline for sports? Definitely do the guidance for sports we have out right now, because as far as I know, there's no extra guidance for gym. Can you please provide our permission slip for the testing at tomorrow's meeting? I believe you mentioned at a previous meeting. I believe that's like the Shield document for the app in and app out for the Shield testing. So please contact Beth for that. We have her email up on our website if you need it, but Beth is very responsive. Instead, I think I just spoke with her today. So thank you for coming. And I know I'm supposed to look at the questions now. Hopefully they're easy.
Michelle, you did a great job. There aren't that many
Thank you.
questions, so while you're checking those out, I will just reiterate some announcements. Again, we're here every week for the foreseeable future to give you latest updates. I had a few people contact me during the meeting offering to help with those priority areas that we are trying to reach. I appreciate you reaching out. I sent you a private message, Dr. Lee. Please email me so we can talk further about that. And if we have any other updates, I will make sure we put them in the slide for next week. And if we do not get to your question or your answer by this week, make sure you email it and we will try to get that answer for next week. So, Michelle, go ahead. You have the floor.
Awesome. Okay. I will try my best to answer all your questions the best I can. First one, do we need to get permission from CCDPH to use the test to stay option or just inform us? Just let us know. If you guys, we might check if you actually have like, the testing program in place. We might check if the social distancing, by just you telling us if the social distancing rules are followed, because we rarely have school lie to us about that. You guys been great. So, actually, look like Paula already answered it. Will we receive a copy of this presentation or are we able to request? I know that our education team, which is Kelly and Deidre, has been helping us with uploading our presentations. So hopefully we will get that up soon. Correct, Kelly?
All registered participants get copies of all the slides every week, so they will be emailed to you when opportunity arises, probably Monday. Maybe.
And like, man, that's good to hear. Good to hear from people I know too. Thank you. Next question. If vaccinated individuals are close contact, why would we not have them quarantine or require testing, knowing that they can get and transfer the Delta variant? That is correct. They could get and transfer it. However, we feel that the risk is very, very low to the point that we don't feel that, we need to quarantine them. I'm not saying it won't happen 100% of the time, but we are saying that, the risk is low and our goal is to get the kids and the staff in school as much as we can. Close contact guideline on slide 5 and 6 is five if they test positive, say all contact. I'll have to look back. And just so you know, I copy and paste a lot of these from IDPH. Sometimes, you kind of know the guidance, but then when you actually have it in writing, it reads a little bit different. Close contact guidance on slides seem to be like if they test positive, 6 say they are all close contacts. You know what? I'm not sure I understand the question. If you don't mind clarifying that a little bit down,
Michelle, would it
and
help if
I'll
I repeat
just,
you the questions?
yeah, could you
Okay.
please?
So he says close contact guidance on slide 5 and 6 seem to contradict. Slide 5 says if they test positive, quote, and slide 6 says, and they're all close contacts. Can you clarify the
It may be
slide?
on slide 4.
Oh,
Oh,
4.
all right. Oh, are you meaning a confirm and a probable case? Okay, I see what you mean now. You know what? When, as epidemiologists, a lot of the terms that we're so used to using that we think everybody understand what we meant, but when we actually when someone actually asks us, be like, oh yeah, this is not people normally use in everyday life. So a confirmed case is anybody that has a positive diagnostic test. So your antigen test, and things like that. And this one is actually anyone that's a close contact and has symptoms. So that's kind of the difference. They are probable case if they're a close contact and have symptoms, if that makes sense. With those cases, we try to do the quarantine right away just in case they really are a positive case. But with the CDC definition, if someone actually, even if someone who's a close contact and have symptom, but they have a negative PCR test, not an antigen, it has to be a PCR test, they would consider to be not a case, in which case we end up releasing a whole lot of quarantine. So for example, we have someone, their mother is positive, they're symptomatic, and we quarantine their whole sports team. And then we turn around because they test negative, having to release them all. So ideally, we try to avoid that. We know it's kind of like an evil we could not always avoid, but it does happen.
So don't report anyone who's a close contact but asymptomatic?
No, so this is to report confirmed and probable. The next one is to report the close contacts. So these are all the categories of people to report to us. And I totally get it because sometimes when I write something and I see it in some of the IDPH documents too, it's like it's clear to all the epidemiologists, but when the school nurses ask me questions, I'm like, oh yeah, that's not something people usually use in everyday life.
Don, if you still have further questions, we have Dr. Corpix who's on the line. Maybe she can provide some input. If it is not clear, please let us know. And please let us know, Dr. Corpix, if you're able to jump in. Or I think I see Dr. Moeller is on as well.
No, I understand it now. I think it was the asymptomatic, but we're still going to report if that they are close contacts.
Sure.
That's correct.
Thank you, Don. Okay, let's get to the next question. We're getting close on time. We're getting some questions from PE teachers regarding indoor pool use during PE classes. Students cannot wear masks in the water. Should we disallow swimming altogether?
Just so you know, we were getting some cases from water polo at the end of the school year. We would ask the school to try to do the best to do social distancing during PE classes, but we're really trying not to limit activities in school because of masking.
Okay. If we don't get a direct answer regarding water safety, we will definitely look into that and come back next week with an answer for that. Because I'm sure that's one of those gray areas that we're not completely sure about. So we'll make sure we get an answer for that. And then we have someone, I'm sorry, Carrie Cremascoli says, so wonderful to hear your voice, Michelle. You are doing a great job.
Oh,
Next,
thanks, Carrie.
next question. Oh, hold on, I lost my place. If during quarantine options 7 and 10, do you need a mask outside?
That is a good question. So generally, we do not ask the student to be masked outside. We do ask students to be social distant for right now. And that's the only guidance that I've seen so far. I believe CDC do have some masking recommendations for masking in crowded places, but as far as like, Illinois guidance, it is just the masking indoors.
Great, thanks. Is test to stay only allowable during low or moderate transmission in our area? I think you might have discussed this already.
Yeah, a little bit. We are allowing the test to stay during the substantial and high transmission. We actually started talking about it in the beginning, and I believe some of the health department around us are not allowing for the test to stay, but us at the Cook County Department of Public Health is allowing the test to stay with it, thinking that we would be able to keep as much kids at schools as possible.
Okay, great. Next question. Can you discuss when a student is home with COVID symptoms, what's the policy should be for siblings? I think you mentioned that in your presentation.
I did, and we should get something from IDPH new FAQ when it comes out. Like I said, I think during our webinar with IDPH, they did mention that, the student have 24 hours to be tested and the sibling could, stay in school until then. But we really don't want to shoot ourselves on the foot before it came out in writing because I don't know if you remember when they did the 7 and 10 day short quarantine, they didn't tell us the student weren't allowed to use the 7 days until it was out in writing.
Okay, we're getting close on time, so we may not get to answer all the questions, but we'll make sure we copy the chat and get these questions so we can make sure we get these out for next week. So just 2 more questions and then we're going to have to end for the day. We're close to time. So next question is regarding contact tracing. Student is symptomatic today. If contact tracing done for today and yesterday, or today, yesterday, and Wednesday?
So if they start being symptomatic today, it would be today, yesterday, and the day before. Because remember, it's 48 hours before I should say, no, it's 2 calendar days before the onset of symptoms. So it's today plus 2 calendar days back.
So it'd be Wednesday, Thursday, Friday if they're symptomatic today, correct?
Yes.
Great. Okay, and last question, and we're going to make sure we get the chat and then we follow up next time. Jenny Chan says, hi, Michelle. Thanks for presenting today. For quarantine option 3, is day 5 considered within 48 hours of day 7?
So day 5 is considered the 48 hours of day 7, but if you read option 3, it actually say after day 5. So the test should be done on day 6 and the return day would be day 8. And that is counting the symptom at day 0.
Okay. Okay. I apologize for the questions we did not get to. We are past our time. Thank you guys for your time, taking the time out of your day to meet with us and get this information. We'll make sure we copy the questions in the chat and we'll make sure we get these answers on next Friday's webinar. We appreciate your time. And just as a reminder, all of the webinars are being recorded and uploaded to our website as well as our YouTube page, and the slides will be emailed out at a later date. Thank you all. I hope you had a great first week of school and get some rest. Enjoy your weekend. Thank you and be well. Thank you, Michelle. You did a wonderful job. We will
Oh,
see you
thank
all
you.
next
And
week.
you know what? I don't know if you are going to be able to copy some of like the private questions that was sent to me. So if you
No,
guys want to just email those to me.
no, I can't see your private questions. I can only see
All right.
that came to me. So just I'll keep the chat going. Up for a minute so you can copy it.
All right, I'll do that.
Thank you all. Have a good weekend.
It's
Yes.
Jenna. I have the chat transcript.
Oh, great, Jenna. But you can't see her private messages.
No,
Well,
not
thanks,
the
Jenna.
private ones, but I have the
Please
rest. Yeah.
email that. Thanks a lot, Jenna. I appreciate
Yep.
your help.
Absolutely.
Michelle, let me know when you have that copied and then I'll end the meeting.
Yep, I think I do. Thank you, Kelly.
Thanks. Have a great weekend. Thanks, Jenna. Thanks, Palak. Thanks, Michelle.